Hello, everyone. Well, thank you for these insights to urinary tract inflammation on a quantitative insight. I'd like to present you now a study we're doing in the moment, a qualitative study. My name is Andreas Nadig. I'm from Zurich, the institution of primary care there. And I just graduated medical studies this year and started in this project last week. So I'm really honored to present you it today. Well, from an antibiotic stewardship perspective, the best case would be just not to prescribe any antibiotics. And the actual situation in Switzerland now is that we have in the guidelines as well that it could be treated without any antibiotics. And we do actually know which antibiotics are used. We somehow know how often patients do not take antibiotics, but we do not know so far is just the reality in the management of UTIs, and exactly this is what we want to find out in order to promote antibiotic-sparing treatment. This study is an exploratory sequential mixed method study on antibiotic-sparing treatments in patients with uncomplicated urinary tract infections, and funded by KHM. Thank you very much so far. It's quite a large study with several sub-studies, and our goal is just to find out the knowledge, attitudes, and some clinical uses of ASPT in UTIs. And also we want to know what are obstacles and also facilitators in the implementation of alternatives to antibiotics. And just for an overview of the project, we have two topics that we cover. It's the alternative sparing treatment with those subjects, and as well we are looking for answers in the professional care. All this is based on semi-structured interviews that are already held or still being held. We are focusing on two settings, the GP setting and also the community pharmacy settings. And they're doing interviews with GPs, non-physician medical staff and patients, and on the pharmacy settings, pharmacists, pharmacy assistants, and also patients, how they have, what experience do they have with pharmacies. And then we analyze all this data and have a qualitative analysis, and based on this we'd like to make a bigger survey to make a quantitative survey. And we have for the GP interviews 15 interviews that are already done, and on for the NPS we have 27 interviews. And actually I'm owning this sub-project, so I'm transcribing all these interviews now, and others are transcribing the community pharmacies interviews. And we still have not done the interviews with the public, the patients. First of all, good news. What do our data tell us? The GPs are aware of this problem or on the option to treat a UTI without antibiotics, and they also try to do it depending on the context and the conditions and preferences. And here we have a graph that is really explorative for the moment. It's telling that here, well, actually how many cases with UTI do you treat without antibiotics means. From the GPs, 8% of them treat less than 20% of their patients with uncomplicated UTIs without antibiotics. And the red bar on the right, as an opposite, 36% of the pharmacies, they treat more than 80% without antibiotics. That means you can see blue left shift, meaning that the GPs prescribe more antibiotics than the pharmacies. And this is what makes it quite difficult to define an appropriateness cutoff for GPs. Means also when GPs see a patient with a UTI, it's often that they have already been treated by themselves or by a pharmacy. And the true proportion of a UTI patients eligible for ASPT in general practice remains still unknown. And also the potential for antibiotic-sparing management in primary care may be overestimated. So, and now looking at some data for that we have from the interviews. Here first, on top, what did the patients say? What do we have from them with the APN? No, it's not the APN, it's the MPA and MPK. So they said that they have a quite wide spectrum what they do. Some are just working in administrative roles, and others they act quite actively in triage, patient counseling, and also in decision making. And what data do we have from the APNs, advanced practical nurses? For them it is still unclear somehow the communication. What do the MPA and MPK say when they are on the phone with a patient? And for them it is quite important just to understand the whole process and recommendations they can give. As well, they are a key group. What is one of the conclusions? That the APNs are a target group for the antibiotic stewardships. Another conclusion is that it is quite important to have just a consistent communication, either within practice and also between the settings, between pharmacy and practice. Now looking at what the patients say, that there is still not a hold, and we will have the answer. What do they think of the pharmacies and of the GPs? And also the GPs tell us that lots of the patients still go before consulting a GP. They go to pharmacies. And what the data shows us from the GPs is that astonishingly a lot of the GPs do not know what pharmacies are doing and what they are offering, and that there is actually no communication between the GPs and the pharmacies. That concludes that there should be established a better understanding and better communication between those two settings. Yeah, and just the outlook for next few months and years. By the end of next year, we hope to have a better data regarding the management of patients with uncomplicated UTIs. And from these data then, we'd like to derive concrete areas for action to determine how and where antibiotic stewardship interventions are needed. And then finally, in the end, to make concrete statements from interprofessional perspective about what is needed for all parties involved to deliver a consistent message to patients regarding the management of their symptoms. Yes, well, that's all of the project. If you have any question, I try to answer the best I can.